So just walking out of the session on hidradenitis suppurativa, one of the most important points that I think of whenever I walk into a room is how this patient has maybe never been informed about what causes their disease. They use the word infection to refer to their own lesions. They've heard that word from other providers. And so I try to right-size them, or if I can convince them not to use that word because I think it doesn't capture what's really happening in their skin, to help them understand their immune systems do work and they're working too well. And they have inflammation, not infection. So I think to help them understand that this disease happens because of their body working too well and we need to tone it down. Some of the ways that we can do that, and it is very exciting, some of the data I presented showed that clinical trials have increased by 50% just from 2017 to 2018. That means we have a lot of opportunities to treat patients with new medicines that may work better than the ones that we have already. And one of the things to keep in mind with a clinical trial is if somebody's been exposed to a biologic like a TNF inhibitor, they now have to wash out of that drug for about 3 to 6 months, depending on the drug that they received. And so for somebody who walks into the office and we can get them into a trial right off the bat, I do that, rather than starting them on a biologic and then trying to get them into a trial, which is problematic. So thinking about trials as first-line therapy, especially for people who are starting to have tunneling lesions. But also lastly, I think an important point, as dermatologists, we're used to thinking about categorizing the types of lesions that we see on people's skin, especially with acne. We look at a person's face and we're already starting to fit them into a treatment algorithm based on what types of lesions we're seeing on their skin. And we can do the same thing for HS. We can think about whether they have isolated abscesses and nodules as their worst type of lesion. We can think about whether they're developing tunnels and whether those are single or whether they're really starting to get coalescent disease in a body area. And if we're starting to see those things, we need to ramp up the treatment. We need to get the inflammation under control. Just as we start to pull down stronger therapies for scarring acne, we need to see scarring on the skin of our patients with HS, the tunnel formation, and we need to take the next steps with the most effective therapy we have on hand.